As people in our community stay active well into their later years, the need for high-quality orthopedic care is rising fast. More people than ever are seeking solutions that keep them moving and living life to the fullest. And to meet that demand, UnityPoint Health and ORA Orthopedics are expanding their partnership and coordinating care across the Quad Cities region. Joining me now is Anna Monsager, a manager of surgical services at UnityPoint Health Trinity Muscatine, and Dr. Michael Pevich, orthopedic surgeon with ORA Orthopedics. Thank you both for being here today.
Thank you.
Thanks for having me.
Oh, well, yeah, I really appreciate you coming in. So let's start with that demand, Dr. Pevich. Demand for orthopedic care is rising quickly. Where do you feel like that growth is coming from? Why is this happening?
Well, for a few reasons. There's no doubt that people are living longer now with advances in medicine, and living longer puts increased stresses on joints and spines and these things. And people want to be able to continue doing things that they wanted to do when they were younger as they get older. Next, there is a bit of an obesity issue, and obesity affects joints, puts increased stresses on joints. But that's not just in an older population, that can be younger, and we'll see some 40 or 50-year-olds that are already experiencing some of the effects of obesity. But either way, whether you're talking about an older population, a younger population, an obese population or not, people don't want to sit on the sidelines anymore. Nobody's ready to sit in a rocking chair on the front porch with an Afghan in their lap. They want to keep doing what they normally like to do, whether it's playing golf or pickleball or just playing with your grandkids or going for a walk. So people want to keep doing what they want to do, and they want to do that without pain.
Things are changing. And what types of issues are you most commonly seeing when it comes to, you already spoke about joint wear and tear, things like that. Balance issues? There
are definitely balance issues. Yeah, there can be some neurologic things. That's not so much in our realm. We'll get them to the appropriate person. But as far as joint issues, it's going to be joint replacements. It's going to be arthroscopies. It's going to be shoulder issues.
Yeah. Okay. So Anna, when it comes to treatment, what types of advancements have been made? I mean, we talk about the way that care has evolved, and how are those advancements helping?
Yeah, so one thing we all know is that healthcare is always changing, and I've been fortunate enough during my time in the OR to see some of those advancements, such as robotic-assisted surgeries and more minimally invasive procedures being done with greater precision, better outcomes, and just really letting our patients bounce back quicker.
Yeah.
You couple that with same-day surgery, and patients are able to recover from the comfort of their home. They're no longer having that lengthy hospital stay.
I mean, I have to wonder how many people are surprised as well when they finally make that, book that consultation, have that appointment, and they're learning about A, these advancements, and B, how quickly they can be in and out and resting from their homes. They've got to be going, why did I put this off for so long? It's really got to make a big difference. And so with that said, doctor, can we talk a little bit about earlier diagnosis, early intervention, and how that can really affect a long-term diagnosis?
Yeah, well, somebody who has a sprain of an ankle, for example, we don't want to just ignore that. Back when I was a kid, the advice for a sprained ankle was rub some dirt on it, walk it off, you're fine, right? And that was bad advice, because now we see a lot of people coming in my age that have bad ankle arthritis. And you do want to intervene, you do want to get them involved in physical therapy and rehab, these sorts of things. Somebody that has a meniscal tear, you do want to take care of that in a younger person so that it doesn't turn into an arthritic knee down the road.
Yeah. And we are talking about a partnership here today, Anna. So again, UnityPoint Health and ORA Orthopedics. Can you talk a little bit about the purpose behind this expansion and just really trying to grow this partnership?
Yeah, so by bringing our expertise together, we're able to strengthen communication and really ensure that our patients' treatment plans are fully aligned, offering them a more seamless experience.
Yeah, it's got to make a really big difference when people see that there's that much support.
Yes. And so by expanding our capacity, we can support more surgeons and offer care to more patients across the region while still creating opportunities for our workforce with surgical techs, nurses to support staff.
Yeah.
So ultimately, the collaboration is just to get our patients back to doing what they love with great outcomes.
Wonderful. Okay, well, and doctor, can we just ask you quickly before we wrap up how this collaboration is really kind of changing the outlook for patient care here in the QC?
Yeah, I think it's going to be good for the for the patients of the Quad Cities, because again, we are doing the earlier discharges and things along those lines. But this is a community-wide thing. You know, ORA has been in this community for nearly 65 years. UnityPoint has been in this community, and we live here, we work here, we're going to retire here, we're going to possibly see you at Hy-Vee.
Right.
And so we want you to have a good experience. We want you to be able to come in hassle-free. When somebody gets hurt, the last thing they want to do is, am I in the right system? Do I need a referral from my primary care doctor? And you can come to an urgent ortho care where you're not going to be treated by somebody who also treats sniffles and pink eye. You're going to see somebody that takes care of just orthopedic issues.
Right.
But you're in this community. We want them to be as hassle-free as possible to get their care and let it start now as opposed to down the road.
Well, thank you both so much for being here today. We really appreciate chatting with the both of you. And we've got much more to come on the show.